Welcome to the Beauty and Health Institute online educational videos. Here at the Beauty and Health Institute, we use gold standard technology. We will be using the Gentle Max by Syneron and Candela, which incorporates two of the most powerful wavelengths in the energy-based industry. The 755 nanometer Alexandrite and the 1064 ND YAG, which is clear to treat skin of all color, in particular dark and ethnic skin. Currently, 37% of the United States population is composed of ethnic skin. By 2020, it will be close to 42 to 45%, and by 2050, it will be well over 50%. In some demographics, especially here in Florida, we are already seeing that change, which is why you are seeing an influx of non-optical or ethnic-friendly energy-based devices. So let's begin talking about the Gentle Max. Again, it's the 755 and 1064 wavelengths, and before we get into the actual roleplay, let's cover some quick preventative maintenance points on the lasers themselves. Number 1, all lasers have a cooling mechanism to keep the laser cool. There is a lot of thermal heat that gets built up inside the laser. What's important to know is that there's distilled water which gets put in the back of the laser to keep it cool. What isn't widely known is that you must check that while the laser is on. Checking the water while the laser is off can give you a false positive. Turn the laser on, stick your finger in the back of the reservoir tank, and make sure you can feel water. If not, pour distilled water into the tank while the laser is on. This will give you a positive reading, and therefore you can keep the laser cool. The other thing that lasers have are filters. In the case of the Gentle Max, it pulls cool air from the bottom. There is a filter on the left bottom of the Gentle Max that slides out and can be simply cleaned and reinserted. This, along with checking the water, should be done once a month. Upon pulling out the filter, just inspect it to make sure there is no hair or dust, which can prevent the cool air from being sucked in from the bottom. Once you do that, you can slide that back into the laser. If you have one of the older Candela lasers, either the Gentle Laze, Gentle YAG, or for those who have the Gentle Laze Plus or the Gentle YAG Plus, behind the right front wheel there is a grate. Just rub your hand behind the front wheel. You will feel a little grate. If that is clogged with dust or hair, just take a plastic knife, scrape it off, and that should increase the warm-up time for your laser. Other items for preventative maintenance include the lenses. In the handpieces of all the Candela lasers, there are lenses, and in this case, the Gentle Max, it has individual sliders which use different spot sizes depending on your treatments. If you want to keep them clean, at the end of every treatment with alcohol, they should be rubbed down. The actual distance gauges which touch the patient should be sanitized using Cavicide wipes and not simply rubbing alcohol. Being more hygienic by using better quality cleaning products will give the client confidence in your place of business. Remember, there are 6 skin types, 6 being African American and 1 being Caucasian. When you are using the Alexandrite, a package should be about 6 treatments, which can include 2 free touch-ups after your client's 6th treatment. Keep in mind that roughly 80 to 85% of the entire market for hair removal for women aged 25 to 55 is still untapped. These are the latest statistics as of fall 2012. Before the first pulse on the client, I will let them feel the cooling mechanism. With candelas, you have the option of using either Zimmer air cooling or cryogen. At Beauty and Health Institute, we use the Gentle Max with cryogen option. Syneron Candela uses cryogen to make the treatment more comfortable, but also, more importantly, to lower the temperature of the epidermis to 4 degrees Celsius. This way you can have the most safe and effective treatments. The two most important things we can stress with lasers are, start low and go slow with fluence energy increases, and wipe down the skin before you begin to eliminate competing chromophores. By having cosmetic makeup on, oil, spray on tan, or anything on the skin, you now have a competing chromophore. These chromophores will absorb the light and it will intensify it through the process of conversion of heat. This is one of the top reasons for burns. Let's start with treating the axilla. We are about to begin the treatment. You just let the patient feel the nice cooling spray, which lowers the perception in their brain of what they are about to feel. Do you start straight for the middle? No. You need to begin on the periphery of the axilla because there is less hair, less chromophore, and thus more comfortable as your patient's initial experience into hair removal. Working your way from outside to inside will be exponentially more comfortable for the patient and increase their experience perception. Being honest with the patient and letting them know ahead of time that the laser is only effective when it destroys the hair follicle, and in order to do so, it must be at precise settings and it may feel like a rubber band snapping against the skin. We encourage our technicians to have a rubber band around their wrist to communicate verbally and visually to the client what they should feel. Here at the Beauty and Health Institute, we learned a simple trick to combat the ultra-sensitive patients, the type of patient who may feel more pain than others. Simply by pushing down with 2 fingers as you follow the laser will decrease comfort through the gate theory. One way this trick works is by taking some of the brain's attention away from the constant zap of the laser. Secondly, the patient will notice the extra care you are providing. This combination gives you, ladies and gentlemen, miracle fingers. Please understand, if you are using settings that are too strong, no matter what you do, the patient will feel a burning sensation that even the miracle fingers will not work on. This may not be widely known, but in the world of laser hair removal, one of the popular areas of hypopigmentation is on the shin bone. Light reflects off the bone, and similar to customizing a treatment on the axilla when you do legs, we would recommend that you do the back of the legs because there is less hair and less chromophore, hence more comfort. Let them know that they may feel a bit more discomfort on the shin since the bone is much closer to the skin. Do not hesitate to adjust the setting if the patient feels more discomfort. This will lower the risk of hyper or hypopigmentation. Let's talk a little about the depth of penetration. You have different spot sizes, and you must know how and when to use them. 18mm spot size is the largest spot size of a continuous beam in the industry. When using the 18mm spot size, you need to think of it as a cone going into the skin, like an iceberg. The bigger the spot size, the bigger the cone of thermal energy. So knowing that hair doesn't grow as deep on the face as it does on the rest of the parts of your body, you may want to consider, depending on the wavelength, lowering the spot size to 15mm. Let's use the example of skin type 4, which can be either Hispanic or Eastern Indian, and she has finer hair with less melanin. So what does that tell you as a clinician? It's less chromophore. So in this case, when you are using the ND-YAG 1064nm, it is recommended you start off with a 15mm spot size. When you need more energy, remember, energy and spot size have a relationship to one another. The smaller the spot size, the more focused energy. With the Alexandrite, you can get a lot of great work done with the 18mm spot size throughout the entire treatment package. With the ND-YAG, however, it's considered a non-selective wavelength. The ND-YAG does not have a super high absorption to any particular chromophore, like the hair or in this case melanin, but has a mild absorption to a lot of different chromophores. So what you do is use a shorter pulse duration in some cases, or longer for darker skin types. As for the hair on the face, starting with a 15mm spot size is highly recommended for skin type 4. If you are treating skin types 5 through 6, which are African American or Persian, you can use the 18mm simply because of the fact that the hair is thicker, there is more chromophore. What is really important before treatment as well as after? Avoiding the sun. Remember that the sun stimulates the melanocytes in the epidermis, which is great if you want to have a tan, but not so much for laser. Remember to educate your patients by telling them that melanocytes are what gives skin color. The more melanin in the skin, the more chance of light being absorbed by the skin before penetrating deeper to the hair bulge and shaft. If this occurs and you do not have sufficient epidermal cooling and protection, then it can cause hyperpigmentation and may take up to 6 months to go away, or hypopigmentation, which may be permanent. So before your patient leaves, you must tell them to put sunblock on twice a day, every day for 2 weeks. Technically, we should all be wearing sunblock every day of our lives, but I want to be realistic here. You might think this is too much, but if you tell patients only once a day, you will be lucky if they put it on every other day. It is very important you educate them on this fact, not just because it is the right thing to do, but also because this gives your clinic a selling point. Every hair removal clinic should have no problem selling sunblock. Thank you very much, ladies and gentlemen, for downloading the intro to this laser video.